Youth and Family Counseling Service here in Westfield. I'm just really glad people have decided to join us. This is a really difficult topic, but really important. I think many of us realize that there's a need to have some discussions, but they're not easy. And so hopefully this will give us some information, some guidelines. I welcome any questions, and we can get started. For those of you here, you have your packets of information, and it just follows along with the slide presentation. This is entitled Parent and Family Counseling, Navigating Mental Health, and Family Therapy Starts with Parents. This sounds pretty obvious, but the reason for it is navigating mental health is a challenge, and I think part of why people are resistant or struggle even once they start the process is because there are some challenges that hopefully this will help clarify for you. So starting with something as simple as the actual diagnosis. A mental health diagnosis can be difficult to understand. There's a lot of terminology often included in that diagnosis or in the discussion with the professional who's making that diagnosis. And sometimes I think, as professionals, we just say things and not always follow up to make sure that the person, understands that. So if you feel that way, if you've had a situation with a diagnosis and you're like, I have no idea what that means and this is kind of hard for me to follow, first of all, you're not alone, and we're going to discuss some of the definitions and some of the ways to distinguish what's going on with your particular diagnosis. So there is a difference between mental health and mental illness, okay? And I think people confuse this often, and it's an important distinction. Mental health, we all have mental health, right? And it's our capacity to think, feel, and act in ways that enhance our ability to enjoy life and deal with challenges. So whether we like it or not, life does have challenges, and people find ways to cope with those challenges. But we also need a balance of things that we enjoy to have that enjoyment in our life. And for the most part, if you have those two areas of your life balanced and you're not experiencing any symptoms, and we'll go into that, we will have ups and downs. That's what we do. That's what people go through things, and it's not going to be always the same steady, say, feelings or moods or responses. But mental health is not necessarily a negative thing. So I think that's what's important to note. You can have good mental health, and good mental health looks like this definition: the capacity to think, feel, and act in ways that enhance our ability to enjoy life and to deal with challenges. Now, there are mental health issues, okay? This can affect and diminish our capacities that we would normally use in a healthy way, cognitively, emotionally, attentionally, that can interfere with the two areas of life we want to keep in balance: enjoyment of life and interactions with society and our environment. So cognitive simply means thinking. So if you're overwhelmed, you're stressed, you have a lot going on, that can affect your thinking. So that's a mental health issue, perhaps. Emotionally, maybe you're a little more sad, maybe you're crying more, maybe your mood's a little bit low. And then attentionally is difficulty focusing or paying attention. And things like that, of course, can interfere with our life. This can be the result of a particular incident. It can be situational. Someone dies, someone's sick, some major life change, even if it's a good change. You've moved, you have a new job. These things can diminish, at times, our capacity to have healthy thinking, healthy emotional feelings, and so on. So that's mental health issues. Now, what's different with the third category is these are mental health illnesses, because mental health can be an illness. There are diagnosable things, just like a doctor's office when you go to a doctor and you're diagnosed with a cold or a flu or some intestinal issues. There's a real diagnosis code that the insurance companies will use, for example, and that will identify what you're being treated for. Mental illness is the same way, and these are conditions that can affect our thinking, our mood, our behaviors. These are things like depression, anxiety, or post-traumatic stress. So you can be diagnosed with depression, you can be diagnosed with anxiety, you can be diagnosed with post-traumatic stress. And it's more complicated than that. So this is the next level of diagnosing. So if you had one of those diagnoses, we'll go with, say, depression, there's a continuum, as you see. Healthy is normal functioning. We do get depressed sometimes. We can't avoid ever being depressed. So, that's your baseline. That's kind of a normal place to be. There are mild symptoms that can come up. For example, common and reversible distress or situational. Stress for an exam, stress because something's happening in your life like we discussed earlier, some change. So, of course, you're going to have some of those symptoms. Moderate level gets a little more serious, and you have significant functional impairment. And this can affect some of your social and financial things, as it mentions here. These are things that maybe there's a breakup or there's financial pressures, and those things would have significant symptoms as opposed to, say, compared to mild. Okay, so instead of having sleepless nights or you don't sleep for days, the symptoms that you would see under mild, many of us experience. Moderate tends to be a little more severe. Maybe you have no appetite, you don't eat as you normally would. So that, again, it's a continuum. So severe is when you have severe and persistent functional impairment. That level generally requires some intervention. And depending on what it looks like and what your symptoms are like, it can involve a whole series of treatment milieus or situations, and I will go over that as well. So severe impairment is what you're typically seeing as a diagnosis that is a treatable level, like you would see someone has been inpatient, for example. Okay, so these other areas, the mild, moderate, tend to be addressed in what we're more familiar with, most of us, which is outpatient, seeing someone once a week or twice a week kind of a thing. So severe is when you're really going into a higher level of care. All right, so you find out some information, and maybe you have a severe diagnosis of anxiety or depression, and or someone you care about. So again, this is also about family members, because as families, mental health issues, illnesses can affect the entire family. So you see something going on, you have a diagnosis. What can you do? And the underlying subtitle there says, do not normalize or ignore unhealthy behavior. Many times in my experience, when people do take that step, that very important step to ask for help, it is after a lot of thought, consideration, or something significant enough, painful enough to make them make that step. And one of the hardest things I see is people who try to normalize it. For example, you have a family member, let's say a child, whose behavior has suddenly changed. It's not what it used to be. You're concerned about it. They're much more irritable. They're throwing things. They're getting into more trouble, maybe, at school. But you're gonna make excuses and kind of normalize that, or ignore it completely if you can. And sometimes it gets to a point where you can't. But that is not the solution. That is definitely not the solution. So obviously in severe and extreme cases where something's happening in that moment that is serious enough, you do call 911. I would err on the side of caution always with this. Don't second guess yourself. If your gut is telling you this is really serious, I'm really concerned, you can call 911. It will, diffuse the situation immediately. Often, just seeing that person arrive, the whole sense of someone in a uniform, and oftentimes that person does need this level, and it's a relief if you see that. That person can kind of perhaps somewhat de-escalate just seeing that someone's here to help. And at that level, that's really the only intervention that's going to work. If someone's threatening you physically, if someone's threatening to do something to themselves. Eventually, once someone is stabilized, the next steps you would take, you get to the emergency room, they're going to take care of you there. But at some point, you're going to want to check your insurance information to try and find out what your insurance benefits are, and they will help you set up an appointment. Check through websites and ask someone you trust for referrals. So the luxury of time only comes after the crisis has been addressed. That 911 call gets you to the emergency room and can help you stabilize the situation. Those other two steps will happen, after that has been done. Anyone here have any questions?
I just wrote down, when you're making a call to 911, are they sending the police? Are they sending medical people?
I think it varies with towns, but most of the time it will be police and a medical person.
Together?
I would say both, yes. Yeah, typically that is what you'll see. And that's a good question, and that's a good point, because many times I've spoken with families and they've shared with me something that went on. And, this is after the fact that the person's been stabilized, and then they're seeing, because we do outpatient where I work, so we're seeing them in an outpatient setting. And you ask the question, why didn't you call the police? And that's what 911 really is. And a lot of people are super uncomfortable doing that. And it's not easy, not to minimize it by any means, but it's something that sometimes you just really have to do. It's going to get you what you need as quickly and safely as possible. I've had people share, oh yes, my child was, acting very unpredictably, and I was getting nervous and concerned. I put them in my car and I started to drive them somewhere to the hospital. That's not a good thing to do. You're not equipped to handle a situation if something goes wrong between your drive, from home to the hospital. So it's always best, like I said, err on the side of caution. Usually today, people are very well trained that are doing this work. They come into a situation with some knowledge, I think better than maybe, before, which is a good thing. We've been working closely with these, other resources in the community over many years to be better at handling these situations. So I think they do a really good job.
Right, so they're not coming to take them to bring them to the police station. They're coming to bring them to, or wait for the medical people and then bring them for medical
Right.
attention.
The way it works typically is the police will get there to stabilize things and make sure everyone's safe in that, in that sense. And the medical people are with them. They usually kind of come at the same time. And then the medical people will do what they need to do and get the person in an ambulance and bring them to an ER, Okay. So it's really important, if you're experiencing things that concern you with yourself or someone else, and you can, try to educate yourself as to you know, what's going to happen, what's going on. So, for example, you know, you go to the ER or you see a psychiatrist and they tell you you have major depressive disorder with mixed unspecified symptoms, or, you know, some long diagnosis. That's not going to mean a whole lot to you. So that's why I'm saying, like, don't focus on the diagnosis, the name that's given to this particular thing that we're seeing. What's important is that you look for treatment and medication options that work for you with that person who's giving you that diagnosis. I think people are somewhat reluctant to ask those types of questions. Well, what should I do? Should I follow up with a psychiatrist? Should I go to a therapist? Should I, you want to try your best to be engaged and ask as many questions to educate yourself. I mean, this is not a routine experience for most people, that you wind up either, in an ER or in a therapy setting. And in time, you're going to be able to ask questions that are more suitable for your lifestyle. So the answer isn't always just medication, right? There's treatment options that are available. Again, once things have calmed down, you're in front of someone, you're working on a treatment plan, explore other options. There's nutritional things that can be addressed. There's a lot of alternative treatments today. Most of us are familiar with, say, aromatherapy, for example, acupuncture. And for some people, that's a great option and it works and it helps. For other people, it may not, but you'll only know if you try some of these things and be open-minded to it. I think especially for young people, most parents that I have experience working with, as well as psychiatrists, are reluctant to first, address the problem with medication. I think that's something we do try to hold off on, especially with younger clients, for obvious reasons. But ultimately, that may be the treatment method that's necessary, and then there's there's so many more questions around that. That's why I say ask questions, ask more questions. And the other thing that's so important to remember, and I see people struggle with, is trusting the process and be patient. And that's why it's so important that you try to find someone you can trust and that listens to you. There's plenty of people who do all kinds of work in this area. Take your time and try and find somebody that you feel comfortable with and you can trust and you can be honest with. And this trust the process is something that comes up often as well. Unlike some other types of, say, medical things, mental health involves a process. It involves a relationship with the person working with you. And it requires a lot of patience on your part as the person seeking out help. Because it's not like you break your arm, you get an x-ray, they mend it, and then you go to maybe you have to go to some rehabilitation for that, for 2 or 3 weeks or whatever after that. It's just not that kind of thing. And it requires someone being engaged and committed to the process to see the best results. Okay, so for those of you here, there is a handout. And that first handout is very kind of classroom-esque, and it just has a lot of terminology. But I think it comes up, and I think it's important. And I know there are times when I'm speaking with people, either just through an intake process, that this terminology is not something that they really understand. So things like we've been talking about, I've been mentioning inpatient, for example. What does that really mean? Versus partial hospitalization versus intensive outpatient. These are all different levels of care, and eventually stabilized and in outpatient. And then there's the different titles of what professionals do and what specifically a psychiatrist does versus a psychologist versus a licensed social worker or professional counselor. So I think it's so important because that alone, people, you know, when you're throwing words at people and that, you know, they seem familiar, say, to me as a person providing this information, you know, I have to remind myself that maybe someone doesn't really understand what that particular terminology means. And if that happens with you, I encourage you very much to just ask questions. Ask questions for sure. So that's something you can take with you and take a look at in more detail. So again, this just talks about how therapy is a process. Psychotherapy or talk therapy is a way to help people with a broad variety of mental illnesses and emotional difficulties. Psychotherapy can help eliminate or control troubling symptoms so a person can function better and can increase well-being and healing. Which is, I think, you know, a little bit of what we've been talking about here. Today, there are options for both in-person and virtual treatment, and most therapists provide both at this point. I know that at Youth and Family Counseling, we certainly provide both. There are some organizations that just do fully virtually, but I think most are doing both at this point. And I encourage you to make that first call if something's going on. And to the best of your ability, honestly share what you are experiencing. There are symptoms that you could definitely identify and say, you know, things like, I'm not sleeping, I'm not eating, like we said earlier, difficulty concentrating, I've been crying a lot. So there's definitely some real things happening that is making you make this first call. So try your best to share what those things are. You don't have to share necessarily in that first, say, phone call, you know, what personally is going on with you, but so someone has an idea of what the symptoms look like. And as you're the person in treatment, or the person you care about is in treatment, and this I say for the benefit also of parents who are taking children to treatment, right? You want to keep your scheduled appointments. They're hard to get, they take a long time if you have to reschedule often. And it's important, you have to be consistent. And again, this goes back to what I was talking about earlier with, it's a process. You're building a relationship. I work with a lot of young people. I've looked at the top of kids' heads for hours because they just have their head down, they don't want to talk to me. But in time, you can work through that in a relationship, in a trusting relationship. So that takes time, and it happens best if we're consistent with the appointments and, you know, question what you don't understand. And I encourage even my younger clients, you know, of course, you know, I don't necessarily have all the answers. I'm here to listen to you and try and work some things out the best I can. I don't know everything. I absolutely do not know everything. And I'm more than happy to share that. And so, you know, ask questions for yourself, for your kids, right? Also provide feedback to your therapist. I often encourage people to let me know what's working, what's not working. You know, it's an hour typically of time, and then you're on your way, and we make suggestions, you know, try this coping skill or that coping skill, or, you know, and then you come back and you say, I really hate walking, I'm just not walking. Okay, then let's find something else, right? So it's kind of interesting if you look at it this way, and people I think can be surprised by this. You're the one doing all the work. The client is doing really all the work, because I don't know what's going on once you get home. I don't know how this particular coping skill or medication is working for you. And it's kind of your job to let me know that, or let that person know that. Try your best to be honest and genuine, and be yourself. There are plenty of people who go into a session with a plan of what they're going to say and how they're going to present something so it sounds a certain way as opposed to the truth. And I'm sure, you have an idea of what I'm talking about. It's any age group, but certainly, with kids, they will often downplay what's going on, for a variety of reasons. But adults too, and unfortunately, it's still one of the hardest things to get people to talk about, is how they're doing emotionally or what's going on with them, genuinely. And we've come a long way with regards to that, I think, as a profession, and as people in general. But it's the work is not 100%, for the therapist, and I think that's important to remember. It's a team, collaboration. Any thoughts, questions, comments on that?
Currently, my daughters are going through some therapy session, but
Right.
they really don't like the therapist. They don't feel comfortable yet.
Can I ask how many sessions roughly?
We've been at this since December. It is now September.
How many sessions would you say that look like if you went, once a
Oh,
month, twice a month?
Every week.
Oh, every week.
every
That's a
week.
lot of sessions.
Yeah, and they still not comfortable.
Okay.
So I had to move one out to get to. But am I able to tell the therapist that they're not comfortable? I don't want to be rude and be like.
That's a really good question. I would say 100% you are able to share your concerns, right? And there's a lot of different things that could be happening, so I don't want to say like it's any one thing.
Yeah.
But first of all, with kids, it takes a very long time. And second of all, I think that it depends on what style they're using, and some therapists have a style that
Okay.
doesn't agree with whether you're an adult or a kid. It just doesn't work for you. There's different styles that people have, so it could just simply be that. Sometimes when people say, especially kids, I don't like my therapist, that means it is working.
Okay.
That means, in some cases, that the therapist is making them look at things or change things or talk about things that they're not necessarily comfortable with, or, but they should be and need to be. So that's why it's real important for you to have that
Okay.
conversation. It could be any one of those things, or something else.
So how
So.
will I say, the kids verbalize that they are
Yeah.
comfortable? Is there
How would
some
you
way
say it? Say it the way you said it to me when you
Okay.
explained it.
Okay.
Just be yourself and
Okay.
just say, I'm concerned, and here's what I'm hearing the feedback from
Okay.
my daughters, and talk about it,
Okay.
That's a great question, though. Okay, so this goes a little more into therapy for your kids specifically. Early intervention is particularly important for young people. And if we don't have an early intervention, in some cases, you can have a very long, profound life of consequences that could have been, through early intervention, a lot different. Possibly. I'm not saying this is always the case. So we definitely believe early interventions are better. And you could probably figure that out. It's pretty much like common sense. Once you get through things in a certain way, whether it works or not, it's something you're comfortable with. So bad coping skills, right? So, addictions, dangerous behavior. If that's the things you're using to cope, and you have only those tools in your toolbox as a young person, and you start those things early, that can be a very difficult situation throughout your life. And the earlier you can kind of change some of the things you're seeing, which is easier to do with younger people, right? How resistant are adults to change? And once you've done something for a while, it can be a lot easier to do with young children. And there are certainly a lot of resources out there. There's a lot of peer services. There's organizations that do case management for the whole family. I think of Perform Care, if anyone's heard of that. And others, So I would try to without, overreacting or anything, because don't forget that by nature, especially teenagers, are not always the most stable presenting individuals, right? So, don't just find out early. It could be something that you're worrying about that's not what you think. And the website that's noted there is the Mental Health Association, the national organization. So that has a lot of resources on it. There's a couple, and I give more of a list at the end of this, a couple of organizations that provide really good information right on their website. So these are just some of the typical things that children get diagnosed with. ADHD, I'm sure everyone's at this point heard of that. Autism spectrum disorders. I'll talk a little bit about that. Anxiety disorders, mood disorders, eating disorders. Probably the common cold of mental illness, I would say, in general, is anxiety and depression, which is your mood disorders. For kids, it's probably more the ADHD and the autism spectrum disorders. So what's important to note about this is every one of these things here are treatable. And again, why is it so important to get help and treat early? Why suffer? Why should someone be uncomfortable with the symptoms of ADHD untreated? Why should someone feel uncomfortable with an anxiety or mood disorder? Eating disorders are extremely specific treatment modalities, and I'm not an expert on that, but there is treatment for all eating disorders, and often they're through, as I said, specific places that treat just those things because they're that complicated. They often involve a lot of medical care over and above what you might get in other settings. So that's important. The autism spectrum disorders are tricky because they run the gamut of so many different things, and from, as we talked about earlier, mild, moderate, severe. So you don't always know what you're looking at, but it's sometimes considered on the spectrum disorder, things that we take for granted. Someone's socially awkward. Like, I don't know, is that necessarily an autism disorder of some kind? Something to address perhaps, but I don't know that it's necessarily a disorder. And these are the things you have to work out with your professionals. And that could be a psychiatrist who does like a full assessment to really find out what's going on. Therapist at some point, to talk through some things. Some things are not, all these things are treatable. So rather than not know and try and manage it, I think it's always best to find out what's going on with a professional and take the necessary steps. This whole big long thing you do not have to read. The most important thing is what's highlighted. The age of consent in the state of New Jersey is 16 years old, which means if you're calling someplace for your 17-year-old, you kind of can't. You can, and most people will tell you to have that person call us, an 18-year-old, for example, as well. And this is the actual wording for that law. I would say 99.9% of the time, the 16-year-old and the parents will work together with you and the 17-year-old. Typically it works out. But what's important, and to be safe and careful, you can sign a consent. Actually, they need to sign a consent form that you are going to be involved in their sessions and their treatment and all that sort of thing. So we think of consent forms maybe in other situations where one doctor has to send information to another doctor and you consent to that. In this case, it's a parent getting permission to work together in treatment with their child who's 16 or older. And I don't know if a lot of people realize that, and I thought that was really important, the age, yeah.
I wouldn't think 16 would be the age. I mean, I would think it would be
18, yeah. So, I mean, as I said, in most cases that I'm familiar with, people work together, the parents and the kid is typically, you know, understanding of
But
this
only
process.
with the permission of the child.
Yeah, at 16 and over, yeah. Yeah. So, be sure to obtain a signed release form. Which will look nothing like that, by the way. It will have all kinds of words on it. Okay, so the second handout is 100% a list of resources. And it's kind of a grid, looks like a grid, and it has the names of different organizations and phone numbers. I don't know if does everyone have that? Okay, again, just to give you an idea of the levels of care and how to navigate through this maze of mental health, notice the breakdown on the contact information. There's detox facilities, there's short-term residential, there's for both adults and for children, co-occurring partial care. Does anyone know what that means or would like to know what that co-occurring partial care is? So co-occurring is, many people have co-occurring disorders, which means not just one thing going on, but two. Someone who has an eating disorder may also be depressed. Somebody who has an addiction may also have anxiety. Technically, that's considered co-occurring. And partial care is a level of care that's between outpatient, which is your once a week, which we're, God bless you, that we're mostly familiar with, all of us going to, you know, once a week session sort of a thing. And inpatient, which is you stay overnight in a hospital. So partial is treatment in between that. It's the bridge between inpatient and going into outpatient. That's what partial care is. Intensive outpatient is a step down from that. So what it typically looks like if you're talking about a hospitalization is inpatient in the hospital, and then you have partial care, and that is a little bit, you're not staying at the facility typically, and then you're going to attend daily groups perhaps, or individual sessions. You're going to get very intense partial care, so it's a step down from inpatient. Then there's intensive outpatient, which is even a step down from that. So instead of going like every day, you're going 3 times a week to the program. So, and those are all listed, and there are obviously many to choose from. Obviously, insurance is a very important part of your decision. And there is recovery-related addiction, things like that, sober living houses. So there is a lot out there, and I think unfortunately people don't realize the differences or where to really make that call to under the circumstances. So hopefully that's helpful for navigating that information. So reach out to the community like that list suggests, as we do at Youth and Family Counseling. We do get support from the Westfield community. We're here today because of a conversation and a working relationship with the library. It's been great. And you can do that too. There are a lot of resources in this community and surrounding communities really. And don't be afraid to reach out and ask questions, as I've been saying. Take advantage of the resources that are there. Again, a list of some of those resources. A lot of these websites, of course, Youth and Family Counseling is the first one listed. NAMI is the National Alliance on Mental Illness. Psychology Today is a more commercially sort of website, but has a lot of good information as well. And then there's the Mental Health Association, the one that I noted in one of the previous slides. Just go and look, and there's no commitment involved if you're just looking for information, or so that's a really easy way to do it. It doesn't even involve obviously picking up a phone. It's pretty easy. And that's the informational part of the presentation. Also, before we wrap, in your folder you should have tips for boosting your mood and mental health. which is just an extra handout of suggestions for things to help all of us, right? We need to do things sometimes to help our mood and improve our mental health. So it's just some suggestions. Some of these things are more obvious than others, such as, go for a walk. It's amazing what that can do. Being outside with nature is a plus. Move a muscle, change a mood is great. In the beginning, it talks a little bit about maintaining good health for things like just eating and sleeping, and we do overlook the importance of those kinds of things. I think we get into routines, or I'll say I get a little lazy and just do what's easy. I think the sleep part on the second page is really important information. Turn off devices at least an hour before bed. I would suggest that strongly with your kids. Eating too close to bedtime for many people, can be a problem, of course, like with caffeine and things like that. So just some helpful hints, hopefully, to assist anyone who might be having.
How about yoga? Do you remember?
I don't have yoga on here, but thank you. That's also a very good suggestion. Yoga's great, yes.
Meditation.
Yeah.
I don't know. I mean, do you think something like yoga takes a while for it to kick in, like where it starts helping your mental health more
I do.
as time goes on?
I do. I mean, some people are like, really way up there and they could instantly get to that place. And I know I can't do that, but I've gone to yoga. So it varies. I mean, how much it helps. I don't think it hurts in any case. I think if you go and you take an hour for yourself and you're focused on something other than the thoughts in your head, which is so much of what we're dealing with when we talk about these things, that it absolutely would help. But you can really pursue that and get some real, intensive benefits from things like yoga and meditation. I personally don't have that level of skills, but I think those things are great, yeah.
And church.
Church is awesome. Spirituality is a part of our health, right? And that's a really good point. And I don't mention it in here. I'm going to have to do a separate presentation on spirituality and mental health. But it is. It's really important. We are spiritual beings, or we wouldn't have these problems, because this is all about our emotional, spiritual stuff, right? So I do think that's a really important thing to look at. And it's a key part of good health, for sure. Thank you.
So I do have a question. Now, I hate to go back to this, but the 911 call.
Yes.
The 911 call as relates to the 16-year-old.
Mm-hmm.
So can they refuse? Like if you think your child is a 17-year-old or 16-year-old, they're having a mental health breakdown,
Right.
and you call someone, can they refuse help?
Every situation is different, and it depends on the level of the threat, right? So police will get involved, for example, if the person's 50 and ready to jump off a bridge. So if it's a high enough level of a threat, it becomes an issue that the police will make sure something happens, right? If it's not that level, they will talk with who's, the person having the problem and maybe negotiate something differently. They may not need the police, they just go in the ambulance and they go, So it depends on the situation, and I can't answer it, without knowing what exactly is going on. And even then, you're like, people lie, I'm certainly, you see something going on with someone, they can say, oh, all right, I'm fine now. But, you don't know, you just don't know that if you don't have that information anyway. But typically, it's a level of safety and health that's going to determine that. So when the police come, if it's, life or death or that level, they're going to stay involved until something is done. And if it has to be through the police getting involved, they will do that. They may just hand it over to the medical, rescue people and just say, like the person's calm enough and willing to go, and they just go. So it depends. not an easy call to make, but so worth it,
Yes, absolutely.
you know, from my experience, I think that,
And, you know, I totally, when you read the part about, you know, if you, for especially young children, if you think there's some issue, or a teacher has said something to you, maybe just a little something, you know, it's really worth getting it checked out when
It
they're
is.
young, because it can affect the rest of their lives. And
it is.
it's so important to follow up when they're young.
Yeah, and appreciating that's not easy for someone to say, you know, I have to do something about this because my child has a problem, you know, whatever. And what's interesting about that in things I've observed in just different situations is, you know, no one feels that way when it comes to medical, physical illnesses. If a teacher said, I don't think Johnny can see well, he should probably get his eyes checked and get some glasses. No one's offended by that or has a problem with it or whatever. So it is a different kind of a thing. But if you look at it that way, that is the only way the help will happen, is to make that intervention, just like not being able to see. And, you know, this poor kid then struggles to read his whole life, you know, what kind of an impact that has, you know. So, yeah, it's not easy. It isn't, but it's worth it.
Now there's commercials I've noticed lately about drug addiction.
Mm-hmm.
And they're saying it's a mental illness. It's an illness, and it can be treated. So you shouldn't ignore it. You know, you shouldn't just say, "Oh, he's just a bad kid. He smokes too much pot or whatever."
Right.
You know, it's something that can be treated. And you know,
Yes.
if you really think it's a problem, you need to go and look at it.
Right, and it is a diagnosable thing under the diagnostic tool that we use to select what's going, you know, the codes we actually use. There's a whole section on substance abuse and you know, not even substance abuse, other things you can be addicted to, right? Things that we don't think of, but you know, you think of maybe gambling or something, but most, depending on what the situation is, addictive disorders can be almost anything, right? I mean, you can be addicted to just about anything. But it is diagnosable, and it's a part of the diagnostic tool that we use, so.
Not easy.
No, it's not easy. All right, well, thank you all for attending, and I hope this was helpful.
Thank you, Ms.
The
Pinto.
information I included has the contact information for myself and the agency, so feel free to reach out. And thank you for coming.
Thank you. So we get to keep this very
And you get a
Long
couple
clip.
of little freebies, yes.